If you drink coffee and then immediately brush your teeth, you are accidentally sanding away your enamel every single morning. Stop doing it. In the next 8 minutes, I'm going to show you the 30-minute rule that saves your smile. Your enamel gets softer as you age, and that toast and orange juice you just ate made it even softer. We will cover why your toothpaste acts like sandpaper on a chemically softened tooth. We will discuss the exact time you must wait to brush, and the one thing you can do instantly to get fresh breath without destroying your teeth. Let's get into it. For years, we were taught to brush right after every meal. It seemed like common sense. But for those of us 60 and older, that routine has become dangerous. Your teeth are changing. They are not as tough as they were 20 years ago. The hard shell around your tooth is called enamel. Think of it like the protective glaze on a ceramic mug. Over time, that glaze thins out. The biggest enemy isn't the sugar in your food, it's the acids, nitrates. When you eat breakfast, maybe some orange juice, a piece of fruit, or that morning cup of coffee, the pH in your mouth drops sharply. This acid does something sneaky. It temporarily softens the outer layer of enamel. It's like turning hard concrete into wet plaster for a few minutes. Now, what happens when you rub sandpaper across wet plaster? You scrape it away completely. That is exactly what happens when you brush a minute after eating. You are physically removing microscopic layers of enamel that your body cannot replace. This leads directly to sensitivity, yellowness, and eventual tooth breakage. We need to treat our teeth gently. If you want more simple, evidence-based health fixes that improve your everyday vitality, not just dental health, tap the subscribe button. We focus on gentle movement and smart nutrition here at Silver Smile and Bites. Now, the core secret to stopping this erosion is understanding the 30-minute rule. After eating or drinking anything acidic, your saliva gets busy. It's trying to neutralize the acid and bring the pH back up. Crucially, saliva is full of calcium and phosphate. These minerals naturally rush to the softened enamel to start the repair process, often called remineralization. But this process takes time. It takes about 20 to 30 minutes for your saliva to effectively re-harden the enamel shell. If you interrupt this repair process with a toothbrush, you wipe away the soft enamel and your repair materials. You must wait. The 30-minute rule is your buffer. It allows your body's natural defense system, your saliva, to do its job. So, what should your new morning routine look like? It's simple. First, when you wake up, brush your teeth before you eat or drink anything other than water. Overnight, bacteria build up. Brushing first gets rid of that bacteria and the plaque film. It prepares your mouth for the day. Second, enjoy your breakfast and your coffee. Take your time. Then, the important part, wait 30 minutes before touching that toothbrush. Many people tell me, but I need fresh breath immediately after coffee. That is a valid concern. Fortunately, there is a simple, effective, and free solution that dramatically speeds up the remineralization process: the pH balancing rinse. All you need is a big gulp of plain water. Swish it around forcefully for 30 seconds, making sure it touches every surface of your teeth. This washes away food debris and, more importantly, dilutes the acid left behind. It helps bring the pH up faster. This simple swish is your best defense between eating and the 30-minute brushing window. Don't underestimate the power of rinsing. It is better for your enamel than any mouthwash. Speaking of mouthwash, many popular blue and green mouthwashes contain alcohol or harsh chemicals. While they promise fresh breath, they often cause more problems for older adults. Alcohol dries out the mouth. And what did we learn about dry mouth? It means less saliva. And less saliva means slower remineralization and higher acid levels. It becomes a vicious cycle that leads to decay. So if you feel the need for an extra boost after rinsing with water, choose a fluoridated, alcohol-free mouthwash. Use it time it's moist you brush, not immediately after eating. The key is separating the acidic phase from the brushing phase by at least half an hour. Think of this as protecting your financial savings. You wouldn't invest your retirement fund without research, so don't erode your dental investment through a simple timing mistake. Protecting your teeth is about managing time and moisture. Let's talk briefly about the tools you use. If you are brushing twice a day for 2 minutes, but you are pressing too hard, you are still causing damage, especially on that exposed enamel near the gum line. Many older adults find they grip the brush too tightly. This is where moving to a soft bristled brush, or better yet, an electric toothbrush, can save your smile. An electric brush does the work for you. Many models even have a pressure sensor that lights up if you press too hard. This is an excellent investment for gentle, effective cleaning. Remember, you are scrubbing a delicate surface, not scrubbing grout. Gentle circular motions are key. We want to clean the debris, not abrade the enamel. What about those afternoon snacks? The 30-minute rule applies there too. If you grab an apple or a handful of crackers, which often have hidden sugar or acid, a quick water rinse and a wait time will protect you. It's all about consistency. Make the water swish your new habit right after finishing any food or drink that is not plain water. This habit dramatically lowers your risk of cavities and sensitivity that often plague us later in life. Some of you might be wondering, but what if I take medication that causes dry mouth? This is extremely common, as many blood pressure and cholesterol medications affect saliva flow. This makes the 30-minute rule even more vital, because your natural defense system is weakened. If you have chronic dry mouth, you need to be constantly working to restore moisture. Carry a water bottle everywhere. Sip frequently. Consider using xylitol mints or gum after meals. Xylitol is a natural sweetener that doesn't feed decay-causing bacteria and actually stimulates saliva production. Xylitol acts as a little biological friend, helping your body create more of that crucial, mineral-rich saliva. But always check the label. Ensure your mints or gum are 100% xylitol and not mixed with regular sugar. This small change, combined with the timing shift, doubles your protection against erosion and decay. It keeps that liquid calcium flowing to where it's needed most. Let's quickly review the new protective morning routine. First, brush right when you wake up using a soft brush. Second, enjoy your acidic breakfast and coffee. Third, immediately after finishing, do a powerful 30-second water swish. Fourth, wait the 30 minutes. During this time, your saliva does the heavy lifting of repairing and rehardening your enamel. Finally, you can brush again if needed, using that gentle technique. This simple adjustment shifts your teeth from a state of constant repair to a state of constant protection. It is a powerful, evidence-based secret. Remember, taking control of your dental health is a huge step in maintaining overall vitality and confidence after 60. Simple, evidence-based steps always beat quick fixes or expensive treatments. If this timing adjustment has opened your eyes to a healthier routine, please like this video. It tells us we are providing valuable, actionable information. If you want more simple, concrete tips that improve your everyday health, hit that subscribe button right now. Your health and your smile are worth the small effort of making this new habit stick. Keep smiling strong. We need to dive a little deeper into why this shift is so important for the older generation specifically. Young adults have a much thicker layer of enamel. They can often get away with brushing slightly too soon, but after 50 or 60 years of life, wear and tear, medications, maybe some aggressive brushing habits of the past, have thinned that protective shield significantly. We are now dealing with a more vulnerable tooth structure. This vulnerability is why sensitivity is such a common complaint. When the enamel thins, the underlying dentin, which contains tiny tubes leading to the nerve, becomes exposed. That sharp pain you feel when eating ice cream or taking a sip of hot tea, that's exposed dentin reacting. The timing fix, the 30-minute rule, is one of the most effective, non-prescription ways to reduce sensitivity over time. By letting the saliva re-harden the enamel and facilitating remineralization, you are slowly but surely providing natural cover for that exposed dentin. This isn't a quick fix that works overnight. It's a foundational change that yields results in months. Patience is key. Your enamel took decades to thin out, but we can protect what is left by being smarter about timing. Many people also ask about highly acidic foods and drinks beyond breakfast staples. Think about things like vinegars and salads, citrus fruits during the day, or even carbonated sodas, even the diet versions. The carbonation itself is acidic. Treat any of these items the same way. Enjoy them. Rinse immediately with water, and then wait half an hour before brushing. This management of acid exposure is often more important than how perfectly you brush. Let's quickly address those moments when you simply forget. You finish your snack and absent-mindedly grab the toothbrush 5 minutes later. Don't panic. If it happens occasionally, it's not the end of the world. Just be mindful of the mistake, and tomorrow morning, commit to the 30-minute wait. Building a new habit is challenging, so forgive yourself and move forward. Consistency beats perfection every single time in health. We've talked about what not to do, but let's talk about maximizing the brushing time when you do. Once the 30 minutes have passed, we want maximum mineral delivery. Fluoride is a natural mineral that strengthens teeth. For older adults, we highly recommend a fluoridated toothpaste. It bonds with the enamel surface, making it stronger and more resistant to future acid attacks. Look for toothpaste specifically marketed for sensitivity or enamel repair, as these often contain higher concentrations of helpful ingredients. Also, be sure to brush all 3 surfaces of your tooth, the outside facing your cheek, the inside facing your tongue, and the chewing surface. Spend extra time near the gum line, where plaque loves to hide, but be incredibly gentle. Use those short back-and-forth strokes, or let your electric brush do the short, circular vibrations. Never use a sawing motion back and forth across your gums. That can cause further gum recession and expose even more sensitive tooth root. We are focusing on effective plaque removal without abrasion. This gentle approach is particularly important because dental structures change. Roots become exposed, and the roots don't have that thick, hard enamel protection. They are softer and decay much more easily. So protecting the root surface requires maximum care and maximum fluoride delivery. Remember, soft brush, gentle pressure, fluoridated paste, and the essential 30-minute buffer after acid exposure. To solidify this change, think about placing a sticky note right next to your toothbrush with the number 30 written on it. This small visual reminder can break the old habit pattern, make it easy to remember the new rule. This is a game changer for protecting your teeth for the decades to come. Your future smile depends on this small change. Let's turn to an often overlooked component of gentle oral care for seniors: flossing. Flossing is absolutely non-negotiable for gum health, which is the foundation of tooth retention. But many find string flossing cumbersome or painful, especially if they have arthritis or dexterity issues. Do not skip this step out of frustration. Instead, adapt your tools. Water flossers have become an incredible tool for older adults. They use a pressurized stream of water to gently and effectively clean between the teeth and below the gum line. This stimulation is excellent for gum health without the physical strain or risk of irritating already sensitive gums. Using a water flosser every night is a fantastic addition to your gentle oral hygiene routine. It removes plaque and food debris from tight spaces that even the best toothbrush cannot reach. Remember, periodontal disease, gum disease, is the leading cause of tooth loss in older adults, not necessarily cavities. By keeping your gums healthy and firm, you are ensuring your teeth have a strong foundation to remain anchored. Think of the water flosser as giving your gums a gentle, cleansing massage every evening. Another critical consideration is how your teeth interact with each other. If you grind your teeth at night, called bruxism, you are causing massive abrasion damage. This excessive pressure can cause tiny cracks in the enamel and dramatically accelerate the thinning process we are trying to stop. Grinding often increases with stress or certain medications. If you wake up with jaw pain, headaches, or excessive wear on your chewing surfaces, talk to your dentist about a custom-fitted night guard. A night guard acts as a protective buffer, absorbing the grinding force and saving your enamel from self-destruction. This is passive dental protection that works while you sleep, reinforcing the efforts you make during the day with the 30-minute rule. Finally, let's circle back to diet and pH. We can't eliminate all acidic foods. They are often nutrient-dense, like tomatoes and citrus, but we can adjust how we consume them. Try pairing acidic foods with non-acidic foods. For example, eating an orange followed by a piece of cheese or yogurt. Dairy products, especially hard cheeses, are alkaline and contain calcium. They help neutralize the acid in your mouth instantly. This is a clever way to fight acid without relying solely on your saliva. A small piece of cheese after a glass of wine or a citrus salad acts as a pH firewall, protecting your enamel immediately. This combination of proper timing, gentle tools, and strategic eating ensures your teeth stay strong and resilient. It moves you away from aggressive scrubbing toward a balanced, protective approach. Remember to subscribe if you appreciate actionable, gentle health advice tailored for the second half of life. We are here to help you live vibrantly. Let's pause on the topic of exposure and talk about fluoride one more time, because for older adults, it's a critical tool we need to fully understand. Fluoride is not just for children's teeth anymore. It is absolutely essential for adult teeth, especially those with exposed roots or existing sensitivity. When we talk about remineralization, the process where saliva rehardens softened enamel, fluoride acts as a supercharger. It helps the calcium and phosphate in your saliva bond more efficiently to the tooth structure, creating a stronger, more acid-resistant surface called fluorapatite. For maximum benefit, don't rinse immediately after brushing with fluoridated toothpaste. After you've completed your gentle 2-minute brushing session, 30 minutes after breakfast, remember, simply spit out the excess toothpaste. Don't follow up with a vigorous water rinse. Leaving a thin layer of the fluoride residue on your teeth allows it to continue working and absorbing into the enamel and root surfaces for a longer period. This simple change amplifies the effectiveness of your toothpaste dramatically. It turns your nighttime brush into a mini fluoride treatment. Now, what if you have concerns about the safety of fluoride? That's common. But modern dentistry strongly supports the use of topical fluoride in toothpaste for reducing adult root decay, which is very common after 60. If you have significant dental erosion or are highly prone to decay, your dentist may even recommend a prescription-strength fluoride toothpaste or varnish treatment. Always discuss your specific dental needs with your provider, but understand that using a pea-sized amount of standard fluoridated toothpaste twice a day is one of the easiest, most proven ways to maintain strength. Let's quickly address those small irritations that are common in aging mouths: canker sores and oral abrasions. These aren't usually a threat to your tooth structure, but they certainly affect your comfort and compliance with your hygiene routine. Often these sores are aggravated by abrasive toothpastes or the alcohol in traditional mouthwashes. Switching to a gentler, non-foaming toothpaste and definitely eliminating alcohol-based rinses can dramatically reduce the frequency and severity of these sores. If you find that brushing is becoming difficult due to hand mobility, remember that adapting your tools is crucial for consistency. Look for toothbrushes with extra-large handles or specialized grips. Some people even find attaching a tennis ball to a regular toothbrush handle makes it easier to hold and manipulate. The goal is simple: keep cleaning effectively, even if your body changes. Your adherence to the 30-minute rule and a thorough cleaning routine will make the biggest difference in the long run. Don't let small physical obstacles sideline your dental health goals. Adapt and overcome. Finally, while we focus heavily on the timing of brushing, let's briefly emphasize the evening routine. The nighttime brush is arguably the most important one. During sleep, saliva production naturally drops, meaning your teeth lose their primary defense mechanism. Plaque left on your teeth before bed has hours to cause damage in a dry environment. That's why the evening brush, followed by gentle flossing or water flossing, is non-negotiable. It resets the environment for the night and prevents bacterial decay from gaining a foothold. Make that nighttime routine sacred. We have covered the timing, the tools, and the supporting habits. But let's look at two specific pitfalls that often accelerate enamel wear in the 60-plus age group. The first is hidden acid exposure. People often focus on the obvious culprits like coffee and soda, but they overlook subtle sources like cough syrups, certain chewable vitamins, and many sports drinks. These products often contain high levels of citric acid or phosphoric acid to improve flavor or shelf life. If you take a chewable vitamin or sip on a cough syrup, follow the same protocol, a quick water rinse and a wait time before brushing. Do not let these subtle acids linger. The second major pitfall is excessive teeth whitening. Many people want to restore the shine and whiteness of their youth, but whitening strips or bleaching agents contain strong peroxides. These chemicals can exacerbate sensitivity, especially when applied to teeth that already have thinned enamel or exposed root surfaces. If you are experiencing high levels of sensitivity, aggressive whitening should be put on hold or heavily supervised by your dentist. There are gentle enamel-safe products available, but attempting to dramatically change the color of older teeth without professional guidance can lead to permanent discomfort. Prioritize strength and comfort over extreme whiteness. A healthy tooth is always more beautiful than a sensitive, overly whitened one. Another crucial layer of protection comes from recognizing the link between gut health and oral health. We touched on the oral microbiome earlier. Your mouth is the entryway to your digestive system. Studies are increasingly linking a healthy, diverse gut flora to reduced inflammation throughout the body, including the gums. If you are struggling with persistent gum inflammation or bad breath, consider supporting your digestive system with probiotic-rich foods like yogurt, kefir, or fermented vegetables. A healthy inside supports a healthy outside. While the 30-minute rule solves the mechanical problem of erosion, supporting your body internally provides the biological resilience. Think of the 30-minute rule as the shield and good nutrition as the armor. If you are regularly consuming foods that support bone density and tissue repair, your body has the materials needed to facilitate that remineralization process that saliva starts. Specifically, ensure you are getting enough vitamin D and calcium, the classic bone builders, as well as magnesium, which helps the body utilize calcium effectively. You don't need to radically change your diet overnight, but be mindful of small additions. A daily serving of calcium-rich foods like leafy greens or dairy alternatives, combined with safe sun exposure or a vitamin D supplement, sets the stage for a strong dental foundation. We are building protection from the outside in with the brush timing, and from the inside out with smart nutrition. It's a combined strategy for lasting dental health. We've now covered the essential principles: timing, tools, and nutrition. But let's address one of the most common emotional barriers to adopting this new routine: the feeling of being less clean if you don't immediately brush after a meal. This is purely a psychological hurdle based on decades of misinformation. The truth is, waiting 30 minutes makes your teeth cleaner and stronger in the long run. Immediate brushing provides a temporary feeling of cleanliness at the expense of permanent enamel loss. To overcome this feeling, rely heavily on the powerful water swish. The sensation of rinsing with plain water, removing debris, and feeling the mouth refreshed often satisfies the urge to scrub. You can even keep a small, attractive water glass right next to your dining area or on your desk as a visual cue to rinse right after eating. Turn the water rinse into a mindful moment, acknowledging that you are actively protecting your teeth, not neglecting them. Another vital tip for maintaining strong oral hygiene is regular and honest communication with your dental professional. Many seniors stop going to the dentist as frequently once they no longer have their children in tow, or they feel embarrassed about aging dental issues. Don't fall into this trap. Routine checkups are absolutely non-negotiable. Your dentist can spot early signs of gum disease, check for root decay, and provide those targeted fluoride treatments we discussed. Crucially, tell your dentist about your medications. They need to know which drugs might be causing dry mouth, so they can recommend specific rinses or pastes to counteract the side effects. Think of your dental team as your co-pilots in maintaining your health. They have the specialized tools and knowledge to support the great habits you are implementing at home, like the 30-minute rule. Never assume a problem will just go away. Proactivity is the key to longevity, both for your body and your teeth. Remember, achieving a vibrant smile in your 60s and beyond isn't about expensive treatments. It's about smart daily habits. It's about respecting the vulnerability of older enamel and adapting your behavior to its needs. By prioritizing protection over power scrubbing, you're ensuring your dental health lasts as long as you do. This small timing adjustment is a fundamental shift that empowers you to take control of your long-term oral vitality. Before we wrap up, let's look at one final, practical adjustment for those dealing with dentures, bridges, or partials. While the 30-minute rule mainly applies to natural teeth, the underlying principle of pH control is still important. Even if you have prosthetic teeth, the surrounding natural gums and any remaining anchor teeth are still susceptible to acid and decay. Always remove and thoroughly clean partials or dentures after eating. This prevents food particles and acid from lingering under the appliances, where they can damage the vulnerable soft tissues and anchor teeth. Use a separate, soft brush and approved cleaner for your appliances. Never use regular toothpaste on dentures. It can be too abrasive and scratch the surface, creating tiny harbors for bacteria. Treat the gums under your appliances with the same gentle care. Massage the gum tissue lightly with a soft, moist cloth or your finger every day to stimulate circulation. Healthy gums are less prone to irritation and infection. For those with dental implants, the 30-minute rule applies exactly as it does for natural teeth regarding the anchor sites. Implants are incredibly durable, but the gum tissue surrounding them must remain meticulously clean and healthy. Gum disease around an implant, called peri-implantitis, can lead to bone loss and implant failure. Gentle care, water flossing, and minimizing acid exposure are paramount for keeping your implants secure for life. Do not think that having expensive hardware means you can relax your vigilance. In many ways, it requires even stricter discipline. Now let's recap the 3 most critical takeaways from this entire process. First, knife the 30-minute rule. Wait half an hour after consuming anything acidic before brushing. Use the time to allow saliva to remineralize your enamel. Second, the water swish Use plain water to rinse immediately after eating. This is your immediate, non-abrasive defense against acid. Third, Muller Gentle Tools. Asterisk. Invest in a soft, bristled brush or an electric model with a pressure sensor. Protect the enamel you have left. Do not scrape it away. Implementing these 3 steps gives you a massive advantage in the lifelong battle against tooth erosion and sensitivity. It's a simple shift in timing that costs nothing but saves you potentially thousands of dollars in future dental procedures. If this video has motivated you to adjust your morning routine and protect your enamel, please hit the like button right now. It is the best way to support our mission here at Silver Smile and Bites, which is providing simple, clear, actionable steps for a better, more vital life after 55. And if you haven't already, subscribe and ring the bell. We publish new evidence-based guidance every week on nutrition, movement, and mindset, all delivered with crystal clarity. Don't let your dental health be a blind spot. Take control of your time, take control of your health. Keep smiling, and we will see you in the next video. We have now discussed all the major components of the protective routine. We established the why, the thinning enamel and acid softening, and the how, the 30-minute waiting window. We also covered the supportive role of water rinsing, soft brushing, and the importance of professional checkups. But let's dedicate a moment to addressing the power of mindset in making this change permanent. Habit change is never easy. We often revert to the patterns we learned in childhood. To ensure the 30-minute rule sticks, you need to link it to an existing habit. This is called habit stacking. For example, your current stack might be eat breakfast to brush teeth. We need to insert a step. Try this new stack. Eat breakfast to water swish, to take morning medication, if applicable, to read a chapter of a book to brush teeth. By inserting a specific short activity, like reading or performing another non-oral hygiene task, into that 30-minute window, you distract yourself from the urge to brush. The medication step is especially effective because many seniors must take their pills after eating, which naturally provides a delay. Use these built-in breaks to your advantage. Do not rely solely on willpower. Rely on smart scheduling. Furthermore, recognize that the reward is not immediate. The reward for waiting is less sensitivity next month and fewer dental bills next year. Keep that long-term goal in sight. Every time you consciously wait the 30 minutes, tell yourself, I am protecting my future self. This positive reinforcement helps solidify the new pattern faster than simply scolding yourself when you forget. We are not aiming for perfection. If you wait 25 minutes instead of 30, that is still far better than waiting 0 minutes. Aim for consistency, not perfection. This gentle, forgiving approach is much more likely to lead to a sustained, healthier routine. Remember, your teeth are a reflection of your overall health and vitality. By mastering this simple, evidence-based timing rule, you are investing in your ability to eat comfortably, speak clearly, and smile confidently for years to come. That confidence is invaluable. Embrace this change and watch your dental health transform. Let's address a key question that frequently arises when discussing acid and timing. What about alkaline foods? Foods like green leafy vegetables, bananas, and high pH water can actually help speed up the neutralization process even faster than plain water. Incorporating an alkaline rinse, perhaps by chewing a stick of xylitol gum, which stimulates alkaline saliva, or even using a small amount of diluted baking soda in your swish water, can be beneficial. Baking soda is a safe, mild abrasive that is highly effective at neutralizing acid quickly. A gentle baking soda rinse, about half a teaspoon dissolved in a small glass of water, is an excellent tool to use right after consuming a particularly sharp or acidic meal, such as a pasta dish with tomato sauce or a vinaigrette dressing. Just swish and spit, and this further ensures your mouth is returned to a neutral pH quickly, reducing the 30-minute window needed for full recovery. However, remember this alkaline rinse is a supplement to the water swish, not a replacement for waiting. You still need that dedicated time for the minerals to bond back to your teeth. Think of it this way. Your saliva has the construction materials, the calcium and phosphate. The acid is the wrecking ball. The alkaline rinse is the cleanup crew that removes the acid debris. But the construction crew, the remineralization process, still needs that quiet time to rebuild the structure. You wouldn't rebuild the road while traffic is still driving over it. This level of detail, understanding the pH balance and how to manipulate it, is the real secret to maintaining strong teeth after 60. It moves beyond just mechanical scrubbing and focuses on the underlying biological process of repair. It means you can still enjoy your favorite foods and beverages without constantly worrying about irreversible damage. Remember that sensitivity is your enamel's way of whispering for help. If you continue to ignore that whisper, it will turn into a shout, severe pain, and eventual tooth loss. By adapting your routine today, focusing on protection and timing, you are answering that whisper with gentle, effective action. This is sustainable oral health,